Hello from the small window on your screen. This is Adam Turtletaub from the Healthcare Compliance Association. I'm happy to say I'm joined today by Jenny O'Brien, who is past HCCA President and Chief Compliance Officer for United Healthcare's government programs. Jenny will be doing a general session with Kimberly Oddie of the Mayo Clinic on influencing decision-making at the 2014 Compliance Institute, which will be taking place March 30th through April 2nd in San Diego, California. Jenny, first of all, thanks for joining us.
You're welcome.
Can you tell us what do you think are some of the key ways compliance professionals can influence decision makers?
Sure. Well, I think first of all, one of the most important skills that a compliance officer can have, it's one of the most important, if the most important, is the ability to influence their leaders up, down, and across the organization. And I think sometimes when we look at the role we have as compliance officers, it's not real defined, and we let others in the organization define what our job should be. So the first thing is we have to come in and understand and define what our role is and realize that we need to focus and have a strategy on how do we influence those around us. One of my favorite quotes as a compliance officer is, let the other person have your way. And what I mean by that is, as I look around my organization, it's really about the art of persuasion. And how I do that is I build relationships, I look at ensure accountability across the organization. I make sure I communicate my strategy and my work plan, and I make sure I report the results. But I try to do that using other people's to send my message. And so really focus on how do I talk to my CEO and what words do I use? How do I influence my CFO? He thinks differently or she thinks differently than my CEO. How do I talk to my chief medical officer? How do I talk to my chief information officer? And become very strategic about how to communicate with each one of those, and then really have the goal of sitting around that leadership table and hearing them say things in my words or what I've spoken to them about.
Interesting. It reminds me of years ago I took a communications class at a previous job, and they talked about you should always talk from the listener's perspective, not from yours.
Exactly.
And I think that's really what you're talking about. So what are some of the common mistakes that you see people make?
I think some of the mistakes, and I've made them in my, I've been doing this since 2001, so I've made plenty of these mistakes and learned from them all the time. But some of the mistakes we make, as I said, are letting other person define what our role is and then going out and acting in that capacity. As a compliance officer, we have a great opportunity to define to the organization what value we bring the organization and what our role is. And as we become better and more effective at our jobs, many ask us to do things that are out of scope of our jobs because we're successful and we get things done and they feel like we're helping them. And so what I work on is to always partner with one of my business owners and make sure that it's not me who's always sending the message, but it's with a business owner for the organization, and really using all the resources around me and all the leadership skills around me to help communicate this. I always say it's our job to lift the issues off our shoulders onto the shoulders of others. One question I ask frequently is, if I wasn't here as a compliance officer, who would be the business owner? And quite often there is a business owner. If there isn't, that's one of the gaps, which is telling me something right there. And if there is a business owner, then that's who I partner with and work with to make sure that we're able to solve the issues that are in front of us and impact and escalate issues to our senior leadership as needed.
It's great counsel. So tell us a bit about Kimberly, your co-presenter.
Sure. Well, I'm really excited to connect with Kimberly. We've already connected once or twice on this as we're planning this session. I have to tell you, it's a little overwhelming to think that we're going to be speaking to 2,000 talented and experienced compliance professionals about this topic. But Kim and I have had quite a bit of experience. Kim comes from the provider side of things and has been on the hospital side of things. And as the chief compliance officer at Mayo, really has many great strategies as how you influence up, down, and across an organization. I'm coming from the plan side. I'm now working for a plan. I was at a provider side at one time, and now am on the plan side. And what we're finding as we prepare for this is, influencing is influencing, and having a strategy is having a strategy. The compliance model should always follow the business model. So Kim has a business model, I have a business model, and all of our attendees and members have a business model, and we're hoping to provide a framework that they can put into whatever business model they have, whether they're a large organization, like the ones we're coming from, or a really small organization where they may be a one-person shop.
Sounds great. And I think people are going to take a lot of good things away from this session. So, Jenny, again, thank you for joining us and participating. We look forward to seeing you in San Diego March 30th through April 2nd at the 2014 Compliance Institute. I'm Adam Turtletaub from the HCCA saying thanks for joining us and looking forward to seeing you there.
Thank you.